There are only 40 programs in the U.S. that offer training in the medical specialty of reproductive endocrinology and infertility, REI. And the center is one of those that offers a highly competitive program. We are an academic affiliate of UConn School of Medicine, and each year we recruit one graduating OB-GYN resident who's looking to further specialize in this field. So today on Lunchtime Live at the Center, we're talking about our graduate medical education program and how it affects you with Dr. John Nulsen, who has led this program for many years up until recently. Dr. Nulsen, welcome.
Thank you.
Back.
Yeah, thank you.
The center is an academic affiliate of UConn School of Medicine. So what does that mean?
So essentially, we provide all of the academic training in reproductive endocrinology and infertility, our subspecialty, for UConn medical students, UConn residents who are specializing in obstetrics and gynecology, and then for fellows who have completed their residency but have decided they want to be like us and they want to be subspecially trained in reproductive endocrinology and infertility.
And what is graduate medical? I'm just trying to change my camera here. What is graduate medical education?
Right, so every medical school has what's referred to as a GME office, or graduate medical education. And they are, in essence, responsible for the training of medical students, residents, and fellows. So they oversee it. They're very rigorously controlled by organizations that have very strict criteria in terms of what services have to be provided, how they're provided, how they're evaluated. The governing body for all of us, it's called the ACGME, or the American College of Graduate Medical Education. So any program, whether it be for residents or for fellows, has to submit an application and has to have a site visit and has to be approved by this organization to be able to offer training, postgraduate training, to residents and to fellows.
Okay, so what is the path for someone who wants to specialize in reproductive endocrinology and infertility?
It's a fairly long path. So it's 4 years of college, 4 years of medical school, then 4 years of training in general obstetrics and gynecology. At that point in time, that individual will be ready to go out in private practice. But if they want to subspecialize in our field, reproductive endocrinology and infertility, they then spend another 3 years in an ACGME approved program such as ours, so that they're fully trained in our subspecialty.
Is it always someone who has an OB, obstetrics and gynecology residency? Is that
right? So that's one of the requirements. You have to complete a residency in OB/GYN to apply for a fellowship in reproductive endocrinology and infertility.
And in those 15 years, when are you a medical student versus a resident versus a fellow?
All right, so when you graduate from college, during college you apply to medical school. So you get accepted into medical school and you complete those 4 years of training. First 2 years are basically classroom. Second 2 years are clinical rotations. For example, rotating through OB/GYN and rotating through subspecialties such as ours. Then after completing your 4 years of medical school, then you apply to and hopefully get accepted in an OB/GYN program, and you spend 4 years in that being exposed to all the aspects of OB/GYN, including general OB/GYN and the subspecialties of high-risk obstetrics, oncology, and reproductive endocrinology and infertility, which is what we do. And then if you elect to subspecialize into one of those areas, then you apply for and hopefully get accepted in a fellowship program such as ours, which is a 3-year program. And then finally, after all that training, then you can go out and practice as a board certified reproductive endocrinologist.
So when someone joins us, they stay with us for 3 years, and does that also mean we have three fellows at all times?
So our program, it's a 3-year fellowship, and we have one fellow each year. As a matter of fact, our brand new fellow just started today,
Hmm.
and they're with us for 3 years. About half of that time they spend in the clinical services, and then half of that time they spend doing strictly research.
Okay. And do we also have residents that work with us as well?
Yes, so part of the requirement for OB/GYN residencies is that the residents have to rotate through the subspecialties. So we will have second year residents from the UConn program spend 5 weeks with us, and then we'll have residents from St. Francis spend 5 weeks with us during their third year. So they'll visit, they'll shadow with us, with the attendings or with the fellows, participating in everything that we do.
And so, how would a resident and a fellow participate in patient care?
Right. So it's very different. So the residents are they're only in their second year of training. So most of their involvement with us is either shadowing with us with one of the attendings or one of the fellows, being under pretty much constant supervision.
Mm-hmm.
They may call patients to do new patient intakes, but pretty much any of the procedures, ultrasounds, or anything they do will be with one of us. Fellows are very different. They've completed their 4 years of residency. They could, if they so chose, have gone out in private practice and be practicing. And they will act in a much more independent fashion. So they will see patients on their own, right? They'll do procedures on their own, but with us supervising them. So if we're not directly supervising them in the room with them, we're 2 doors down the hallway. So we're always available to supervise them in any way that they need. But they have a much higher level of independence, commensurate with their level of training, than would a resident have.
Okay. And they would be present in like morning scans and things like that?
Yeah, so they basically do everything we do. So in the morning, they scan they help us scan our patients who are coming in, or if we're being monitored, if they're doing IVF, if they're using Clomid, that sort of thing. They'll be involved in doing investigative studies like water ultrasounds or hysterosalpingograms. They'll be involved in doing pregnancy ultrasounds. They'll be involved working with us in the operating room, doing hysteroscopies and laparoscopies, always under our direct supervision. As they advance in their training, they'll be involved in doing egg retrievals for people who are doing IVF, as well as transfers, but again, under our direct supervision with one of the attendings in the room with them.
So, how does this graduate medical education, how does it impact our research at the center?
Well, one of the things, being an academic program, that we're really interested in is doing research that will advance the care that we give our patients. One of the requirements for fellows is that they participate in a number of research projects. They have to have research projects to graduate from the fellowship. So they play a major role in conducting research projects, usually under the mentorship, of one of the faculty members. But just to give you an example, sort of a landmark research project that we did here was actually done, believe it or not, when Dr. Engman was a fellow working with Dr. Benediva. They pioneered a treatment that's now used in IVF cycles to complete egg maturation and avoid patients experiencing this thing called ovarian hyperstimulation syndrome. And they published the first papers on this, and that this protocol now has been accepted not only throughout the country, but throughout the world. It's referred to as the UConn protocol. So the fellows working closely with the attendings work on doing research, some of which can be quite groundbreaking, such as was what we refer to now as the Lupron trigger protocol.
Oh, that's excellent. So it's important to the public good then, this education.
Absolutely, absolutely, because most of the clinical studies that we do are very applicable to patient care, analyzing our data, sort of fine tuning what works best,
Hmm.
what results in the most optimal outcomes. For example, every year there's an annual meeting of our professional society, the American Society of Reproductive Medicine. And this year, I think we submitted 5 or 6 abstracts to that meeting, which our fellows, residents, and believe it or not, one of our medical students will be presenting there. So that's sharing our knowledge with other programs so that we all learn from each other and we can ultimately improve patient care.
So is there, in this program, is there also, there's research, there is hands-on, clinical work. Is there any additional like studying and classroom time?
Yes, yeah, it's a great question. So there are a lot of didactics that we do with the fellows. There are formal didactics and informal didactics. So when any one of us as faculty works with a fellow throughout the day, we're working with them and teaching them as we go throughout the day. When we do our rounds for everybody who's doing IVF, they sit down and do rounds with us, so they learn from our experience. But they also have formal didactics. So for example, in our program, every Tuesday and Thursday from 5 to 6, we have lectures for the fellows, either one of us speaking. For example, Dr. Benediva is giving a talk today on stimulation protocols,
Mm.
or we bring in renowned outside speakers, which has been one of the good things with COVID because of being able to do everything remotely. We can now tap experts throughout the country and have them give lectures to not only our fellows but others. So we have sort of a collaboration with Yale and Brown where we bring in really great speakers, and then all the fellows at all 3 institutions, as well as the residents, can benefit from that experience. So they have a lot of didactic teaching that goes on that's formal as well as informal.
Okay. Well, this has been really interesting and informational. Thank you for being here. Thank you for sharing
Sure.
with us. Appreciate your time. But that is all for today. And be sure to check out our website at yukonfertility.com for more information. There's also a calendar of events to support you along your fertility journey. And we will see you next time. Take care.
Take care.